I had what is commonly called a tummy tuck and no liposuction, but they did remove several inches of skin on that lower abdominal and upper thigh area, and the work they did was wonderful. And my pain was minimal. Most people had told me it was going to be such a painful experience. It would take several months, or at least 2 to 3 months, to overcome it. But within 5 days, I was off pain medication. One of the first things I asked Dr. Rehnke about was, am I too old? I'm 64. And so I didn't know whether my skin would react and come back and just be satisfactory in the recovery. And he said, yes, you are, you're fine, and all that. That was one of my first issues. Although I'm 64, I don't feel like I'm 64. I feel like I'm 40, maybe 44, something like that. You know, I don't feel as old as I maybe am, but he gave me positive attitudes about what he could do, what he suggested versus what I thought maybe he should do. And anyway, I interviewed 6 different doctors. He was one of the 6. And I thought he was great, and I went with Dr. Rehnke. After the kids and after I stopped working when I moved here and in retirement, I just kept gaining weight. And so I wanted to lose some weight. I did have gastric bypass surgery. And after that, I lost like about 100 pounds, which I was feeling really great even after 50 pounds. But after about 100 pounds, I had more energy and I was back up to feeling like I was 40 again, and I just felt I could recover from whatever it was that I wanted to do. And so that's why I started looking into this. It took me a couple of years to find somebody that I felt was the person. I did look into other people that had had surgery and had had procedures with him, and I was very surprised to find out that there were people that I knew that had had surgery, and plastic surgery isn't something that people talk about too much, and I don't know whether the doctor is supposed to give you names of people that. So I kind of had to find people by talking and saying, oh, I'm looking into this and I'm looking to do that, and do you know anybody that's ever had that done? And so it was kind of an investigative process on my own. My husband even said to me, do you think it was worth it? Oh, I said I should have done this like 20, 30 years ago if I would have met this doctor. So yes, I think it was well worth it.